Good evening, everyone. My name is John Tays, and I'm the event coordinator here at McNally Robinson Booksellers. If you come to our events before, you'll know at this point I typically offer a treaty territory acknowledgement. However, your host for this evening will be taking care of that in just a moment. So I won't take up too much of your time tonight. Instead, I'll just offer the sentiment that we are thrilled to have so many of you here today on a beautiful spring day to celebrate the launch of Dignity in Care, The Human Side of Medicine by Harvey Max Chochinov. We're particularly grateful to Oxford University Press for publishing this book and for making this evening happen. And also would like to say hello to all of you watching live on YouTube as well, both now and in the future. I just have a few procedural notes to go over before I turn things over to the people you are here to hear from. So there'll be a presentation from this podium following an introduction, after which there'll be Harvey will talk about the book for a little while, and then we'll move along to some special guests who'll be joining us too. There'll be an opportunity for you folks to ask questions. If you are here, please just feel free to put your hand up and I'll run over to you Donahue style with this microphone. Rest assured, this is not a comment on your ability to project your voice. It just ensures that everybody watching can hear your question without us having to repeat it. And just with the standard medical caveat, we ask that any questions be limited to more general questions regarding the book than personal experience. Following the event, the only thing I will put in your head right now is that we'll ask you all to remain in place for just one moment while we safely transport Dr. Chochinov over to the signing table beside our cash desk. I'll have more thrilling notes about signing procedure for you at the end of the event. But for right now, it's my enormous pleasure to call up your host for this evening. That would, of course, be Dr. Bruce Martin, who is a colleague of Harvey's and the palliative care physician extraordinaire. Please join me in welcoming him.
Evening. Thank you for that. I'm not sure where the extraordinaire came from. Good evening. I very much respect the fact that our other host offered to do a treaty and land acknowledgement, and I must admit that I asked if could I please do that for us, for him, and respect the fact that he has allowed me to do that. So just really truly to acknowledge our location here and our privilege here in Indigenous ancestral and territorial lands. I must admit I include not just Treaty 1, but recognize the fact that many of us here have lived with, learned from, and worked with individuals throughout our province, the original lands of the Anishinaabe, the Innuak, the Anishinaabe, Dakota, and the Denezine peoples. We know this is the homeland of the Métis Nation, the original lands of the Inuit as well, and absolutely respect the treaties that have made on these lands. I'm certain that we all acknowledge the lasting impacts of colonialism. We all acknowledge the ongoing systemic racism on Indigenous communities, and we all recognize that we must adhere to, listen to the truth as we stand against ongoing injustices. We dedicate ourselves, and many of you have dedicated yourselves to work towards equity, justice, and reconciliation. And we very much are guided by the wisdom of Indigenous community members, by many of our patients, and by many of our colleagues, whether they be Indigenous or those of us of white settler ancestry. So with that, very much should also acknowledge that much of our work together has involved embracing Indigenous peoples and the challenges of their lives, the trauma and violence they faced, and the issues they bring to them with us to their end of life. That aside. So that aside, yes, indeed, thank you, Colorado, for yet another moment. But it's indeed an incredible honor that I have been asked by our author extraordinaire of the evening to introduce him. But before I do, I wish to welcome all of you as well to this event at McNally Robinson to celebrate the launch of Dr. Chochinov's newest book. I find myself this evening amongst many friends, many colleagues, members of our very vibrant and caring community but also I must add amongst family who are here to join Harvey for this launch as well. There's unfortunately a mantra in my profession that governs the construct of an introduction, so I have to adhere some things. To say that, I have to start off by stating that Dr. Harvey Max Chochinov is a distinguished professor of psychiatry, as you likely know, at the University of Manitoba, and a senior research scientist with CancerCare here, and a distinguished researcher with, I'm certain, well more than 300 published publications. He's the co-editor of what I believe to be the primary international reference specific to psychiatry and palliative care, now in its 3rd edition. And more than that, he's a co-founder of the Canadian Virtual Hospice. So if those of you who aren't aware of it, it's one of Manitoba's truly hidden gems that provides support to people who are facing loss, but also to all of us who are in the circles of care. And then there are the national accolades that part of the construct of an introduction. He's an officer of the Order of Canada. He's a laureate of the Canadian Medical Hall of Fame, with such inductees that include Sir William Osler, the Honorable Tommy Douglas, and Canada's first female physician, Dr. Emily Stowe. He is amongst people of profound accomplishment and contribution to our healthcare system. And why, in addition to all those things, do I applaud him? Because of his immense contribution to all of us. He developed a concept of care referred to as dignity therapy. I'm thinking well over 20 years ago. And if you're not familiar with it, dignity therapy is a brief, individualized intervention designed to engender a sense of meaning and purpose amongst patients with terminal illness. And it contributes a sense of hope and meaning as their life draws close, and provides memories to family members, to their community, to a circle of care and a circle of love as well. And now this, dignity in care, the human side of medicine. You might already know, but this book has been hailed as a quote unquote must read for all healthcare providers. And I believe that to be true. It is absolutely full of incredibly wonderful stories. And I say quite humbly, a few of us are amongst those. And there's impeccable evidence designed here to move healthcare providers and many more of you who provide care towards the human side of medicine. And more than that, it's not only a must read for providers, but a must read for all of you who are in a circle of care for our loved ones, for our community, and for individuals you may not know. So that's the human side, and that's the end of the construct mantra. But further, stepping aside from the mantra, other things that I know about Harvey, and I was probably supposed to shorten things, his joy of reading. I've even got a list of people with whom he would enjoy to have dinner. And I also am pretty certain I know what he would likely serve, but we won't get into that. Perhaps later we will. So without further ado, Dr. Harvey Max Chochinov. Harvey, a mentor of mine, a colleague of mine, a collaborator, and indeed, I would say, a friend and distinguished author. Harvey.
Well, thank you so much, Bruce. That was an overwhelming introduction. It's hard to know what to say about Bruce Martin. He's had a very special place in our lives and in our hearts. Bruce helped look after my mother in her last year of life, and really made an extraordinary difference in all of our lives. I suppose the highest compliment I can pay Bruce is to say that he is an embodiment of everything that is contained in this book. I'd like to welcome all of you on this rather miserable looking evening. Television must have been really bad tonight. Although I know that a burning question in the minds of many is, will we be home on time for the Jets game? We will be done by 8 o'clock. So you will be out of here well on time for the Jets. We have many special people in the audience, beginning with family. My wife, Michelle, my father, Dave Chochinov, my aunt Viti, my brother-in-law, Howard, my sister, Brenda, my nephew Brad, Nessie Cogan, Harvey Cogan, all family, and many, many wonderful friends here as well. There are also some extraordinary people online, and I'm not going to name all of them because I'll miss some of the important ones, but I will say hello to my daughter Rachel, my son-in-law Cam, and my daughter Lauren, who's watching us from New Brunswick. We also have some medical dignitaries, I would say, in the audience. Dr. John Gerard is here. I'm happy that John is able to join us. And we have Kevin Coates, who have been providing me care for decades, and I thank him for his care and for his caring. So let's talk about the book a little bit. I'm almost embarrassed to say how long ago this project began, and I'm looking at Kathy Cullihill, who was my research nurse many moons ago, and her memory is perhaps better than mine, but I'm going to choose the number 8 years. It could have been longer, but I don't want to necessarily remember that much detail. But let's say 8 years or so ago, I thought it would be a really interesting idea to identify some of my colleagues who are not only known to be, exemplary care providers, but also known for their kindness, for their compassion. These are people that I wanted to speak to and find out what exactly did they do? How did they enact, did they operationalize what I've referred to as dignity in care in the course of their careers? And so I invited a group of people, there are about between 20 to 25 of them, and I recorded all of these conversations and I transcribed them, and together with Kathy's help, we tried to wrap our minds around what this all meant and tried to make sense of it. And then it kind of was set on a shelf in a black binder that for many years just languished. And sat there and did nothing. And then came COVID. And I rediscovered that binder and thought, this might be a good time to kind of dust this binder off and to start to look at this and to put together the book, which is, what happened over the course of COVID. During the course of the interviews, by the way, I asked people not only to kind of describe what dignity in care was, but I also asked them to tell me stories. Don't just kind of speak in generalities. I wanted to know the particulars of, so how did this work? Give me instances, tell me about the cases. And we gathered together, I would say, and the book contains, scores of stories, probably 40 to 50 stories, maybe more, and certainly a dozen or two of my own stories added to that. So the book tells those stories and uses those stories to illustrate things that I've learned about providing dignity in care based on the research I've done, based on the clinical work that I've done. So let me tell you who was interviewed, and some of them are in the audience. And for those of you who are in the audience, if you could just kind of wave your hands and sort of be recognized by the rest of the group when I call your name. I don't see him here, but Perry Gray, who is the physician-in-chief at our hospital, was interviewed. Dr. Mike Moffat, who's a wonderful pediatrician, at one time was the head of community health sciences. Dr. James Johnson, a wonderful medical oncologist, hematologist at CancerCare Manitoba. I do see in the audience Jeff Sisler, who's, I believe he's now retired, hard to believe. Jeff is not only a family physician, but somebody who specialized in the area of providing care to patients with cancer and worked at CancerCare Manitoba for many years. Bruce Martin, you've already met, and he indeed contributed many riveting stories that are contained within the pages of my book. I'm delighted to see Michael West. Michael is and again, as I say the words retired, it just seems, is it possible? Has time really moved on for all of us? And indeed it has. Dr. Michael West is a remarkable neurosurgeon, really a pioneer in neurosurgery, introduced gamma knife technology, I believe, here in Manitoba. Pam Orr, Pam is in the audience. Pam is an internist. Oh my goodness, loose dentures at Health Science Center and contributed some wonderful stories. Carolyn Jardine, who is a patient representative or was a patient representative at CancerCare Manitoba. I see Bob Lataki in the audience, and Bob was just a wonderful medical oncologist specialized in gynecological malignancies, an extraordinary clinician and incredible human being. Bridget Johnson, who I think was the most difficult person to reach in this list. I somehow misplaced her email and I put the word out there to say, does anyone know how to reach Bridget? And within the last few days, we connected, and I'm glad to see she's here. Denise Clausen, here as well, a clinical oncology nurse. Cheryl Greaves, a clinical nurse specialist in medical oncology. Kathy Bourne, a pediatric oncology nurse. Corny Welk, who I don't see is here, but he's a wonderful palliative care physician and works in rural Manitoba. Joel Gingrich is a hematologist oncologist at CancerCare Manitoba. Maria Fraser, somebody that Bruce actually introduced me to. She's a nurse who's worked around the world and has spent a great deal of time working in Northern Canada. And some of the anecdotes that she shared really come from her experience of working in Northern Manitoba. Jonathan Wong, a wonderful young palliative care physician. Mike Harlos, somebody, I used to say to Mike, now Mike, when my time comes, and I'm looking up from my deathbed, you're the person I want to see. And he nodded his head and then proceeded to retire. So I'll have to find somebody else to look up to. Jill Taylor Brown, an extraordinary social worker, was the head of psychosocial oncology at CancerCare Manitoba. A couple of special people that I want to mention. We have Selena Fukumoto, and Selena is the daughter of Hayden Dukaran. And Hayden is somebody that I was able to interview. Bruce mentioned this intervention that we have developed called dignity therapy. And Hayden indeed took part in that, gave consent, as did Selena, and his story is contained in the book. And finally, Lois Ackerman, the late Lois Ackerman, I interviewed her shortly before her death, and her daughter Karen is here with us, Karen, and I think your sister Ruth is watching online. Okay. So those are the people whose voices I've had the privilege of listening to and of really being entrusted with their wisdom to pass it along within the pages of this book. So little technical glitch, we'll get to it.
Where's Martin? Always coming to the rescue.
I hope I picked the right page.
All right. My blood pressure is just starting to settle down.
Mine too.
Yeah, yours too. Okay, so I'm just going to do a few short readings. I promise you this won't take any longer than about 10 or 15 minutes, and then we're going to open it up for Q&A. So I thought I would begin with the dedication. And the dedication reads to my wife, Michelle, and our remarkable children, Lauren, Rachel, and our soon-to-be now son-in-law, Cam. In memory of my dear mother, Shirley Chochinov, sister Ellen Chochinov, and Joyce Bassman, never to be forgotten. And I know if my mother here, she would be proud and listening intently. I know if my sister were here, she would be proud and saying, when do I get to have a book launch? And I'd say, we'll arrange it as soon as you write a book. And then there's my cousin, Joyce Bossman, who died at 96 during COVID. She was a remarkable femme fatale. She would be proud, and she'd also been tried to chat up all of the young and available men in the audience. So that's the dedication. From the preface, I just was going to read a couple of paragraphs, unless Bruce pulled it out of here. No, he didn't. Good. Which really kind of provides you kind of the explanation, the rationale for the book. Over the past 35 years, I've learned a few things about looking after patients and what it means to provide dignity and care. As I enter the twilight of my career, as I said, this was done during COVID, I may have been feeling a little down at the moment I wrote those words, but this seemed like the right time to write this book about the human side of medicine and share insights acquired over decades, making them available to anyone whose work or experience brings them into close contact with patients and their families. While I have largely looked after patients with cancer and those in palliative care, the information, skills, and insights I hope to share implicate all patients in all settings. If you are a doctor, nurse, social worker, hospital chaplain, occupational therapist, physiotherapist, physician's assistant, healthcare aide, x-ray technologist, radiation therapist, respiratory therapist, pharmacist, medical receptionist, healthcare trainee of any kind, or a patient or family member interested in dignity and care, this book has been written for you. And then the preface closes by saying, I've thought about these ideas for a very long time and spent years doing research that has shaped my thinking and clinical practice. Besides learning from my patients, I've also been influenced and inspired by many sage colleagues whose voices and stories I have recorded and shared within the pages of this book. I believe I now understand the intricacies and nuances of how to provide patients with respectful, affirming, kind dignity in care. It's taken me a few decades to sort all of this out and put these pieces together. Hopefully, reading this book will help you do so sooner. Okay. So a slightly longer reading, but not too long, I promise, is from the introduction, and it really kind of gives you the tone of what this book is like in terms of being an engaging read, I hope. A few years ago, the physician-in-chief of our hospital, Dr. Perry Gray, circulated a note of complaint from the wife of a patient who'd been cared for in our facility. The note described how her husband had been brought to the emergency room by ambulance, admitted to hospital, and shortly thereafter died. She indicated that most of his care was satisfactory and in some instances, even excellent, with one significant exception. Soon after arriving in hospital, his CT scan had shown that his lung cancer had spread to his abdomen, and he and the family were told to prepare themselves for the worst. Regular doses of morphine were started to alleviate his pain. He survived the night and early the next morning was still able to answer questions from his oncologist. Shortly thereafter, he slipped into unconsciousness. And this is a quotation from the letter that Dr. Gray sent around to the medical staff. Sometime between 10 and 11 that morning, this is written by the wife. So sometime between 10 and 11 that morning, the medical students and residents were scheduled to do rounds. They met in the room situated directly across the hall from his room, then came out into the hallway and stood immediately outside his door. He was in bed too, beside the window. His parents and I were sitting beside him, and the curtain was drawn between us, and the patient in bed 1. In the hallway, I heard someone say, bed 1 is Mrs. X, and bed 2 is Mr. Smith. I was focused on my husband and did not hear what she said about Mrs. X. I then clearly heard a male voice say, Mr. Smith, and a second voice saying, well, I guess we could go in and see if he's still alive. Another male voice laughed, and then the group moved down the hallway. I cannot tell you how painful this was to me. Despite his illness, my husband's death was sudden and unexpected. To hear him dismissed in such a callous manner was devastating. Perhaps a middle-aged man in a coma is not an interesting case, but Dennis was a loving and much beloved husband, son, brother, and uncle. He deserved far more respect than he was shown by these students. The initial comment, the laugh, the lack of reprimand of any kind from the person in charge led me to question the care he'd received and that future patients will receive from this group of future doctors. And that's the end of the quotation. As physician-in-chief, Dr. Gray is often in touch with the medical staff. He told me that no other correspondence had ever elicited the kind of response he received after circulating this letter. Many colleagues approached him, offering reassurance that it wasn't them. Perhaps even more telling was that many confessed that, well, it wasn't them, it very well could have been. No one goes into healthcare with the intention of hurting people or wanting to come across as callous, cold, or unfeeling. Fortunately, most people working in healthcare understand that kindness and compassion are key, even foundational, to being successful in caring for patients and their families. And yet, all too often, there are instances when contact with healthcare is tainted by experiences ranging from vaguely annoying to abrasive or outright emotionally assaultive. Patients may encounter challenges that chip away at their sense of self and pride. This can be as subtle as being kept waiting for an appointment, as insidious as having to wear a plastic hospital bracelet that tracks patients according to an institutional number or a code, or as jarring as being referred to on the basis of a body part gone wrong, the proverbial GI bleed in room 2 or breast tumor in room 3, or as devastating as feeling that their anguish or fear is not being recognized or somehow stopped being heard over the unrelenting din of modern day medicine. And then the introduction ends with a couple of paragraphs that read, for those tempted to read no further, here is the bottom line. Patients are people with feelings that matter. Anyone who chooses to work in healthcare and is in contact with patients simply cannot afford to forget this. Patients are people. People have feelings, and those feelings matter. Well, it may sound simple, perhaps even trite. It is often underappreciated, easily overlooked, and tragically forgotten. That is what happened the morning Dennis died. No one was trying to hurt his feelings or those of his wife and family. No one was knowingly trying to inflict further pain on these people facing the loss of a man they loved. These healthcare providers were likely just trying to make their way through another hectic day, preoccupied with getting through ward rounds, reviewing recent blood work, interpreting diagnostic tests, deliberating treatment decisions, organizing discharge plans, just a busy day, like almost every other day on a typical medical ward. However, despite all this frenetic activity and attention being paid to countless details, the human tragedy that was unfolding in bed 2 next to the window was simply not on their radar. So if you are training and working in healthcare in any capacity whatsoever and have contact with patients, dignity and care, the human side of medicine, should help you understand why caring sometimes gets overlooked and how to safeguard against this from happening to you. This book is meant for anyone entering or already working in healthcare. Well, Dignity and Care was written to benefit patients and how you care for them, perhaps more to the point, how you care about them. It might also help you connect or reconnect with why you chose to work in healthcare in the first place. Sir William Osler, frequently described as the father of modern medicine, said, "The good physician treats the disease. The great physician treats the patient who has the disease." Dignity and Care explores ways in which you can treat the patient and not lose sight of who they really are. Your work requires certain technical competencies and being able to carry out various assigned tasks. But real success requires so much more. After all, patients are people with feelings that matter. And now, as I said, there are many, many stories written throughout the book, and it was hard to pick, any one story because, again, the people who I listed off are all extraordinary individuals, and they really have such deep, deep wisdom. So I chose a story on the basis of length. So this is a very small story, but again, it's sort of meant to give you a flavor of the kind of story that's contained in this text. So I'll read it and then one closing paragraph. Carolyn Jardine was a patient representative at CancerCare Manitoba. She recalls the case of an 80-year-old woman admitted to hospital, quote, with some kind of fracture to her spine in addition to a heart condition. It was extremely painful to move her because she had this fracture. We were struggling to help her. She was completely difficult to work with, upset and crying, feeling like we were giving her bad care. We called in a first-year resident and told him that he had to do something for this lady. We were suggesting big guns pain relief, like a shot of fentanyl, when we turned her. This resident sat down at the bedside and talked to her for not even 5 minutes. He brushed her hair, asked her about her kids and grandkids, and then explained why she was having such pain and got her to realize that if she moved in a certain way, that it wouldn't hurt as much. We ended up not even needing to give her much medication for the rest of the night. It really brought down her anxiety. She felt like the doctor was going to keep an eye on her and make sure that tomorrow morning things were taken care of. It really changed the whole way we took care of this patient, end of quote. So being known instills a sense of trust and feeling cared for, or more to the point, feeling cared about. As this case illustrates, caring goes a long way towards alleviating physical as well as psychological distress. And in the very last paragraph I'll read. So earlier on in the chapter, I point out that, entering into healthcare is not like playing, that game of trust where, you stand and let yourself fall with the hope that the person behind you is going to catch you. In medicine, we don't have that kind of choice. And so the final paragraph that I'll read to you this evening is as follows. And so, who are these people we call patients? They are anyone facing the realization through personal experience that minds and bodies are fallible. Through no fault of their own, they must now relinquish many of the privileges and benefits that go along with being completely healthy. They are people whose autonomy, temporarily or permanently, is compromised. For some, perhaps for the first time, dependency is a hard pill they are being forced to swallow. Little wonder they are frightened, irritated, expectant, and perhaps even embarrassed about the physical and psychological exposure they must now endure. Ask any of them, and they will tell you that they desperately want to be seen as the person that they've always been. Given the chance, they would remind you that they are someone's child, parent, partner, companion, friend, or neighbor. Many might say that they love and are loved, that their lives have meaning and purpose. They now understand what healthcare professionals must never forget. Patients are people, and people can be wounded and torn. In that regard, patients are no different from those who care for them and into whose arms they are about to fall. Thank you. It's not quite as exciting as watching the Winnipeg Jets, but it's the best that I can offer. So we're going to open it up for some Q&A. If there's anything that the readings kind of elicited that you wanted to respond to, as was pointed out by John, who has this amazing kind of FM radio announcer voice, doesn't he? Yes. We're not going to be, answering specific healthcare questions that you might have, but just in case that I'm not well versed in answering all of your questions, I've asked if Bruce can come up to the front so that we have a palliative care physician extraordinaire available to respond. And as well, I've asked that Cheryl Dizon-Renante join us, and Cheryl is the head of psychosocial oncology at CancerCare Manitoba. So if I can ask both of you to come join us. Just a round of applause. Overwhelming.
Maybe I didn't know that I'd get a hot seat.
It's not so hot. So, questions, thoughts, responses, anything whatsoever. Or if there's something that people want to ask some of the remarkable people who participated in this project, who are sitting in the audience, feel free to speak up. And not all at once. I can only take in so many questions at once.
And I will remind you, if you are watching on YouTube, please feel free to write any questions you might have into the chat. Yes.
Thank you, Harvey. Well, there was quite a gap between data collection and writing. So I'm wondering,
What did you see several years later that you hadn't kind of noticed before? Or what struck you as you wrote from that source material from those interviews so many years before that you saw differently, or that kind of felt you may have missed when you were collecting that information in the beginning?
Well, that's a complex question. or it's an easy question, but a complex answer. I mean, you know, life happened. So there were lots of things that got in the way of my seeing, you know, exactly the kind of treasure that was sitting on the shelf. But when I was in a place to actually appreciate the, you know, the wisdom that I had collected, then it became clear that this needed to be done. I guess the other thing, and again, and Kathy, you know, who I worked with for many years knows this. I mean, we've been conducting research in palliative end-of-life care for, I hate to admit it, it's been nearly 35 years. And whenever I do research, I mean, and I explain to my students as well, I mean, doing research is more like football than horseshoes. And what I mean by that is close enough isn't good enough. I mean, if it doesn't get past the goal line, then no one knows about it. So in some ways, I mean, you know, I guess I had this niggling feeling that I've asked all of you, Jeff and others, to give of their time and their wisdom, and people dug deep. I mean, these weren't necessarily easy interviews. I mean, many of them were quite emotionally evocative. And so I guess, you know, besides my coming to the realization it was time to do this, and I was in a place where I felt I could do it, there was a sense of obligation. You know, I mean, I owed it to all of the healthcare providers that I interviewed. I owed it to Hayden Dukaran. I owed it to Lois Ackerman and their families, because they'd entrusted me to do that. So I think that's sort of the long-winded, well, I could go on actually, there are many more details, but that's really why the time from data collection to tonight's book launch was you know, so long. It had a long gestation period. I think, Jeff, did you have a follow-up?
My question was more, what did you see that you hadn't seen before in the data? What struck you? What struck you about the stories that you missed the first time, perhaps when you, like, what did, like, it kind of had gestated for that long? I just wonder if there were things that were clear as you wrote and thought about what you heard that wasn't as clear 4 years earlier or 5 years earlier.
Yeah, well,
that's what I was trying to ask, I guess.
Yeah. Were you happy with my answer though, Jeff? I mean, wasn't it interesting and engaging? I mean, did I not give you some really meaty responses that just like, no, that's a pretty good response. I can live with that.
This question is for either of the three of you. With the change in the demographics of our culture, and I'll just stick to Manitoba, my question is, how does that change the way you teach dignity so that it's culturally relevant in the large, diverse groups that we have here in Winnipeg, for example, and in Manitoba?
We have a difficult question. When you refer to the change in demographics, I mean, I'm thinking there's both kind of the multicultural element of the question, and as well there's the kind of the shift in demographic and the fact that, you know, many of us are longer in the tooth and silver hair, and how are you attentive to issues for those individuals? And one of the things that is kind of I'd say kind of foundational to this whole approach that I call dignity in care is the ability to recognize and acknowledge personhood. So, and we have done a lot of work and gone about various different ways of trying to make sure that clinicians are aware that they need to elicit personhood as part of the work that they do. I mean, if you think about, you know, the training for students in medicine, and maybe not so much nursing and social work, but certainly in medicine, we are very quickly taught how to dissect and how to be attentive to bodies, which is different than being attentive to people. So this talks a great deal about, well, how can we make sure that personhood is on our radar? And sadly, and again, our family just went through this, kind of horrendous year of, seeing my mother get ill and eventually die this last summer. And although she was 92, she was our mother and someone that we valued deeply. And what you see happen oftentimes is people don't see that. They don't see the person. They see that individual as kind of a constellation of symptoms, a problem checklist, a differential diagnosis. And what disappears, from the radar is the individual. So a great deal of what I discuss in the book, and I think it applies across the lifespan, but it's particularly challenging, amongst the aged, because people stop seeing them as being vital, contributing human beings. They stop seeing them for the important individuals they are, and the ways in which they're held by their families and all the people that love them. I'm wondering if either Bruce or Cheryl will have some thoughts about that in addition to that.
So many thoughts, and I think that's actually a very good question. And one of the programs that comes to mind that I'm so privileged to be part of is a training program every year where psychosocial clinicians at CancerCare Manitoba get to, for an afternoon, spend some time with second-year medical students. And it's one of, I think, the fewer opportunities that the young medical students get where a psychosocial oncology clinician and a patient get to visit several classrooms and hear a patient story and have the students ask the patient questions. And then the real neat part is at the end of it, the student is asked to write a letter to themselves about why they're getting into medicine. And then, and here's a secret, they get that letter back on their graduation day.
Was that incredible?
Yes, and so it's neat because my conversations with Dr. Chochinov, formal training from dignity therapy, the books, that's always in the back of my head. I was a baby psychosocial oncology clinician not too long ago, but maybe it's getting longer, but it's through that kind of training that I think is becoming more commonplace. And for example, this week it's Health Equity Week. So much more conversation around the diversity of the people that we get to care for. So we're getting better, but still a lot of work to do.
Bruce, did you have some, Bruce has many areas of expertise, but certainly issues pertaining to multiculturalism and healthcare, that's kind of in your lane.
Some of you know me and I can't be brief.
But you're going to be tonight. The Jets game starts at 9.
Are they one of the original 6? Because if they aren't, I don't know them. I love the question, and I'm going to answer it perhaps the long way or the wrong way. That I truly believe in attribution, and I must attribute much of who I am as an individual and who I am as a practitioner. I attributed to the mentors I had in my undergraduate and medical education. Yes, I attributed to family, to friends, to community too. But I must admit some of my lived and learned experiences in mentorship have fashioned the way I either choose to teach or choose to have people work with me. So by that, I mean that I wouldn't have known to ask an individual, tell me about yourself, if somebody hadn't shown me that way. And I've got too many wonderful stories about tell me about yourself. I must admit, intriguingly, in relationship to the book, intriguingly, if I'm going and doing a home visit for the first time, a patient I have not yet met, who's enrolled in our palliative care program, let's pick a 78-year-old man, tell me about yourself. Well, what do you mean? Didn't anybody tell you I got stage 4 cancer and it spread here, it spread there, and I'm dying. Like, what do you want to know? I said, oh, I wanted you to tell me just 3 things about yourself that I wouldn't know. And there's this, yeah. And so interestingly, there's one passage there from a lived experience like that when I was with another, it's called junior learner, healthcare worker, how to do a home visit and how to position yourself in and with their life. And it's just intriguing. It doesn't take long, and lots of writings would say it saves time over time, but it gives greater meaning to my relationship with them and theirs with me. So the same thing when we have looked at curricular activities to have the opportunity of being mentored and mentorship. I'd also have to fast forward to say, yes, the evolving and diverse community we serve, great attribution that I had the opportunity working in diverse environments as a medical student and medical trainee, so years ago, in principally Indigenous community settings where I was able to learn from and live with individuals. And through that lens, I would say, and in keeping with my acknowledgement of our lands, through that lens, modify how I embrace any individual, regardless of their background, regardless of their newcomer status, regardless of their position in life. So it's a long answer to say that I was very fortunate to have good mentorship and a great tribute to Harvey to capture some of these stories from many of us who are here in the room, and why it should be reading for people who are in circles of care is because I haven't written the book of my lived experience, despite the fact my kids and my wife keep telling me I should. I haven't written it, but some of these recorded passages are incredibly important to me, and important they not be lost.
And I've certainly captured many of Bruce's stories in these pages. Bruce, you mentioned a home visit. As it happens, so one of the final stories that is told in this book is the story of my colleague Corny Wilk, the family physician who works in rural Manitoba, and the story of him doing a home visit and taking a student and then using kind of the insights that are gained through the course of the book to try and unpack exactly what happened during the course of that visit. Just also maybe underscoring again this notion of personhood and how important it is for someone to be known and what kind of a difference that can make. A former head of a department chair of medicine, and I think the story's in the book. I had sat down with him on one occasion, and he'd been treated for I think it was some kind of a hematologic malignancy. And when he was reflecting on his experience, he said, there are days when I was in hospital that I would like to put a sign on my headboard reading PIP, P-I-P. He said, okay, and what does that mean exactly? He said, previously important person. So it's critical. I mean, that is, and that is where I see people really suffering. It's one thing to suffer through, the trials and tribulations of the ailment, but feeling somehow like, you're no longer there, or you no longer are on the person's radar, that you are just a generic patient rather than a unique individual. That is a source of great patient suffering. Yes, Selena.
Mine is more of a comment than a question.
Okay.
A comment and a thank you. So Harvey's mentioned that my dad, Hayden Dugran, is included in his book. And my dad passed in 2020. And he died during the pandemic, 56 years old, living in a personal care home with MS, quite advanced MS. And I just can't say enough how much Harvey doing dignity therapy with my dad, what it meant to him and how meaningful it was for him at such a difficult time. And it really, focused in on his personhood and who he was as a person, as a father, as a friend. And so I just want to say thank you, and just as a healthcare provider and a colleague, just how you always center us around personhood and dignity in our care that we provide, and the epitome really of patient-centered care. And so I just wanted to say thank you so much, Harvey, and thank you for including my dad. It's really an honor to his legacy. So I just wanted to say thank you.
Well, thank you, Selena. It was wonderful to, the memory of speaking with your father and the stories he told and his culture and his family and all that you meant to him. Those stories are pretty indelible in my mind as well.
Certainly. And we do have one question from online.
Okay.
I'll be right over there. So Sarah asks, reflecting on the letter from Mrs. Smith, what could have the rounding physician responded to the hurtful comment about bed 2 to overcome that comment and show respect to Mr. Smith and his family?
Well, I guess, the idea of the book and the idea of developing these various approaches, and again, it's a book of stories, but I underscore that the stories are used to illustrate the research findings, the underpinnings of optimal therapeutic effectiveness and communication. And so the hope is, an ounce of prevention is worth a pound of cure. You would hope that if people were sensitive to the fact that they need to be attentive to people, that person wouldn't have made that comment, that person would have considered, the horrible impact that kind of off the hand comment, and really likely not said with any malice, but without any thought. So that's would be my response is, can we start to change our medical curricula, our nursing curricula, our curricula for social workers, and for really anyone who has contact with healthcare, with patients. And again, the book is not just for physicians, it's for anyone with patient contact. The truth is, if you call up and you're put on hold, or you have a medical receptionist who treats you in a way that is kind of crass and cavalier, you experience that as an affront. So the book is trying to slowly change along with others. This is not a lone effort by any stretch. There are many people who are engaged in this, trying to transform the culture of healthcare into what I would say more appropriately should be, a system of health caring. And there's a vast difference between healthcare and health caring. I think Karen Ackerman had a comment.
Great, so we are just approaching the end, so we can take a comment from you. I believe you had a question also, and we have one more online if that works for you folks.
I'm not going anywhere. Yeah.
So I also want to thank you, Harvey, for interviewing my mom and her family. My mom felt very important when you took the time to talk to her. We were very blessed and honored to share her story as well. Because the end of her life was during the pandemic as well. We dealt with some very difficult moments where there wasn't any dignity and where she had to go to the hospital by herself. And when I heard about the physician that you had interviewed, was in your book, about being an important person, that was part of my mom too. When she went to the Grace in severe pain, and she wasn't treated like an important person. They weren't listening to her story and to what was going on with her body. And only we as her children who were there with her 24/7 really knew what was going on, but we couldn't be there. And we tried, you try and call and say, can I speak to somebody there? Can I give the information that maybe at this moment she cannot communicate because her pain is so severe?
Mm.
But we weren't allowed to, because of COVID, be there, and nobody had time for us on the telephone. So it was a really horrible time. Those 24 hours from her going to one hospital and being moved to Riverview for, for support before she was able to come home was the worst 24 hours of her life and for ours. And so I understand that. We had a few of those things happen. So when we got to tell her story, and it was an honor, by the way. The other thing is I've learned so much from Dr. Martin. I work in pediatric intensive care unit and neonatal intensive care unit. I am a respiratory therapist. So I sadly have to be a part of a lot of end of life times. And I've learned so much, and I look forward to completing reading the book and being able to share it with my colleagues.
Well, Karen, thank you so much, and thank you for being here tonight.
Thank you.
Yeah, great memories, by the way, of your mother, and in spite of how sick she was, when we spoke, I mean, her story was vital and full and with energy, and was told with a great deal of kind of passion and love. So thank you for being here.
Thank you. I'm really enjoying this. I'm really encouraged. However, I'm now retired as a psych nurse, and I've been gathering stories from my friends and connections about how awful the current system is treating their loved ones going through really traumatic experiences in hospitals, probably because of the pressure of the shortage of staff and what COVID has done. And it seems like we're going backwards rather than forwards in terms of respect, compassion, love for our patients. And I'm frightened as I hear these stories. What would you recommend?
Buy the book. Isn't it obvious? I mean, there's a great deal that needs to be done, no question. And I mean, I'm not trying to be kind of Pollyannish to say, you know, we've figured out the problem and we've got it solved. But if we don't start calling it for what it is, and if we don't start saying that, you know, this is what needs to be done, then, you know, we don't make any changes. I got some colleagues, they're doing something that they call the waiting room revolution. They're saying, you know, we spent a lot of time trying to train healthcare providers on how to do these things. It's time to start empowering patients, you know, raising their expectations, you know, making them feel this is what they ought to be getting. And by empowering them, hopefully, you know, along with good education, you know, for medical trainees and empowering patients, you know, maybe we can start to turn it around. But, you know, turning a big ship takes time. Yes,
may I make one comment about your concerns? One comment about your concern. Many of us share them, absolutely. Let us remember that when Pandora's box, she got the lid closed, what was left in the box was hope. And I'd have to say, and be careful, not a political statement, I did read the WRHA Strategic Plan 2023 to 2028, just released last week or 2 weeks ago. And what did I like word searches, I like Wordle, I like Scrabble. I searched that document for things that were important to me. And what did I find? Dignity care should be a component of training to enhance compassion and caring amongst staff of the WHA. A lot of things that I also believe should be in the training, but dignity, care, and caring, and I don't know if you knew that, has been included in the strategic plan to assist all of us in that ripple effect of enhancing the level of care and compassion. And again, I would go to attribution of my own teaching. Had it not been for personhood teaching, dignity care, although we called it different, just get to know your patient, but the ripple effect. So you speaking about the need to elevate the concern that we may be going the wrong direction is an important observation. And amongst all of us, to create that ripple and enhance the approach to dignity and care?
So I know that we've run a few minutes over time. John said that I could make a final summative statement and then he would wind things up for us. So I would just like to thank everyone for being here. It's been a wonderful turnout, a wonderful conversation. One of the last little vignette that I'll share with you, there's a story in here of a colleague of mine. He passed away a number of years ago. His name was Stuart Farber, and he himself was a palliative care physician. And he wrote this wonderful piece that he published in the Journal of Pain and Symptom Management. And essentially, he said that without people knowing his thread, and he used thread as a metaphor to refer to the essence of his life, the essence of who he was as a person. So without people knowing my thread, it's impossible to offer respectful care. So my hope is that this book can get people thinking about the importance of knowing their patients and knowing that patients are people with feelings that matter. Thank you.
Thank you so much, Harvey, and thank you to all of our distinguished panelists this evening and to all of you for your questions, comments, and attention. As mentioned in the opening comments, we will be moving along to the signing portion of the evening, so we will be transporting Dr. Chochinov to a table just beside the cash desk. We ask you all to remain in your place just for one moment while he's safely situated. There are books available at the table. There are also books available at our central cash desk. Feel free to get a book signed before you pay for it. Just please do remember to pay for the book before you physically leave this room. We're grateful to Oxford University Press. The book is Dignity and Care, the Human Side of Medicine. Please join me one more time in acknowledging Dr. Harvey Max Chochinov.